Welcome to Conversations with Jess. Here we're going to talk to some dope wellness professionals. They will be sharing their knowledge, important information that mamas should know. So get ready, get something to take some notes as we jump into our topic for today.
Welcome to Conversation with Jess. Today, I am super excited because we have this awesome woman sitting here before us. She has agreed to take a little bit of time out of her schedule to talk to us about something that's very important. So please grab some hot tea or your drink your beverage of choice. No judgment. This is a judgment-free zone over here.
All right, that's fine.
As you can see, she is fabulous. You not just see this red lip and these cool frames that we got going on over here. Thank you. Thank you for giving us the life. Thank you. She is not only an awesome wife and mother, she is a serial entrepreneur. She is the owner of Caring Chiropractor Practice. Ladies and gentlemen, mamas, are you listening? She will be dropping some jewels and some gems. No pressure, Dr. Rashida. But get a pen and some paper. You want to jot down some notes. I present to you Dr. Rashida Cohen.
Thank you. Thank you so much for having me. I'm honored to be here.
I'm so happy that you are here as well. So we're going to go ahead and just jump right into it. I would love to know, how did you, or what sparked your interest into getting into this line of work?
Good question. Well, I am a doctor of chiropractic. I've been practicing for 23 years this year in Washington, D.C. I, as a little girl, always knew I wanted to help people. So pretty much doctor was what I was thinking. And growing up, I lived in West Africa most of my life, Northeast Africa. And I say that to say that it's amazing how God works. My dad and family, we were all living in Cairo, Egypt, in my senior year of high school. And my family had orders to move to South Africa. And my mother, being the mama bear that she is, we both are, Jess, you know. I'm the oldest of 7 children. There are 6 girls and 1 boy in my family. So being the oldest, I was the first to go away to college. I was going to Spelman College in Atlanta, Georgia. And my mom said to my dad, oh no, we will not be moving anywhere but back to the United States, because what if something happens to Rashida? We need to get to her. She needs us. So long story short, I moved to Atlanta to Spelman. And my family was supposed to move back to their home, but someone was leasing it out. So they had to move to Clinton, Maryland, and they moved pretty much next door to a chiropractor. So every time I would call home, my dad actually became her patient, and the families became close because we have so many children. If you are a neighbor, you're going to probably have someone like our the age of our children. So they became And every time I call him home, my dad was like, Dr. Allison said that you should go to chiropractic school. I was like, what is a chiropractor? Like, I want to be something normal, like a doctor, family practitioner, pediatrician, dentist, but like, okay, whatever, Dad. So I kept ignoring him. And how many of y'all know God has a way of stopping you and letting you know this is what you need to do? So one day I was working out in the gym, and there was a doctor there doing spinal screenings. And I asked his name. He said, well, my name is Dr. Watts. I said, well, what school do you go to? He said, I went to Morehouse. I said, oh, wow, well, I go to Spelman. And I said, well, what chiropractic school did you go to? And he said, well, I went to Life University. I'm like, that's the same school Dr. Allison went to, and she wants me to go visit. I was like, all right, Lord, maybe I should just go ahead and listen to my dad. And so I went to visit him. And at the time, my specialty now is pregnant mommies and babies, infants, families. For some reason, I just love the elderly population. And this doctor's first patient was actually this little old lady. She walked in with a cane. He adjusted her. She walked out. I'm like, I think I can do this. So what really got me was I applied to school, and I applied for a scholarship. When I tell you I got that scholarship, that's really what I was like, you know what? If I don't like it when I get in, I didn't really waste any money. I just wasted time. So I got in, just that I learned chiropractic is natural. And it really resonated with me because growing up, if we were sick, my mom would give us golden seal, lemon, echinacea, tea. We didn't take drugs, no Tylenol, no Advil, no ibuprofen. What's that? So when I got there, I said, okay, this is what I was meant to do. And, moved there, I guess, 1997, graduated in March of 2001, and the rest is history.
Wow. So I don't want to just breeze past this whole the eldest of 7, because I'm sure there's stories in itself, all that. But then you also touched on how your family was in West Africa. I didn't know that at all. I did not know that. Hello, did I not say she was amazing? It just continues. I'm like, wow. Okay.
Funny. You know, it's funny. It's working with people I know and see that rarely comes up. And I'm like, oh yeah, by the way, I'm science school in Cairo, Egypt. I graduated in the desert with the Sphinx and the pyramids. What?
That's
Yes,
so
it's a
cool.
really a wonderful, wonderful, very rich cultural experience for me. And I learned to speak French. I speak a little Arabic, and I believe that as an American, I'm more accepting, like to just different people. And I just
Hmm.
love, where are you from? I love you. I want to learn about you. What you know? And one thing I learned is, we're pretty much all the same all over the world. We're humans. We want to be loved. Want to be treated right, and love makes the world go round for real.
That's facts. That's facts. So let's talk a little bit about your practice, right? So you mentioned how your specialty is, you said moms, pregnant mom or pregnant women, right?
Right.
Children, you said families. Did I miss anybody else? You said another group?
Well, yeah. So mainly, it's pregnant mommies. Their infants. They'll bring their infants,
Mhm.
in days of birth. So my job is to make sure, pregnant or not, that your spine is in alignment. Because when your spine is in alignment, the body functions the way it needs to. The body's controlled by the nervous system. It's the most important system because it controls and coordinates every other system. So your brain is sending signals down your spinal cord to your nerves. And your spinal cord is encased by your bones in the back. So what happens is, from life, these newborns that are born, all this pressure on the head and the neck, whether they're born by vaginal birth or C-section, getting here is rough for an infant. So the babies come to me, and we just use the pressure that you put on a ripe tomato to realign their spines, because typically babies are referred to me because they have problems breastfeeding, acid reflux, colic, constipation, ear infections. Some of them come in like this. We call it torticollis. They can't turn their heads the opposite way. It hurts to nurse. They have tongue and lip ties. But it's a free gift I give to all my mommies. Your baby's first adjustment is free. And we always recommend coming in the first week of life, because those misalignments that are there, the babies can't tell you, oh, my neck hurts and my back hurts. They just cry.
Hmm.
So what I do is just bring them in. We do a free evaluation, a free adjustment. Like I say, it's very gentle, no popping or cracking or anything scary or anything like that. They sleep through it. It's so precious. And from there, think about you. You had hundreds of spills, falls, and accidents. I know baby girl is just having a ball every day, running, jumping with her cute self. What else? You probably played sports, most of us in school, whether it be cheerleading or track or football or basketball. Whose children is not involved? Dance, something, playing an instrument. And these days, okay, this phone.
Hello. Hello.
They call it TikTok.
Yes.
Like children's adults. So my job is, from all of the wear and tear we know in our spine from birth until adulthood, to line it up. Just like you see your teeth and you should see a dentist every 6 months, everyone should have a spinal checkup at least twice a year for prevention.
Hmm.
Because if not, we end up with arthritis, degeneration. You see those little ladies and old men hunched over like that.
Hmm.
Usually what happens. So my job is to line the spine up so the brain can send the signals properly to the rest of the body. And then the body functions better. Now, most people come for neck and back pain, but it also translates to the area of your organs. So those nerves that just go to your neck, back, down your arms and everything, also go to organs. So I have a patient right now who, she has diabetes. And she said, Dr. Cohen, I never told you this, but every time I come see you, my glucose levels are normalizing pretty much to the point where I had to turn off my insulin pump.
Wow.
I was overwhelmed the fact that, wow, it knows what to do and I don't need this, right? I don't
Hmm.
need drugs. So her endocrinologist and I are, every 3 months, he's sending me reports. We're looking at numbers to see how chiropractic is helping this woman with her diabetes. Blew my mind after 23 years. And I'm sure, I know throughout the years, other things like this have happened. But we're doing a case study on her right now. So it's just
That's
chiropractic. Get
awesome.
checked by somebody soon.
That is super awesome. Now, you said a lot of different things that I want to jump in on. So you were talking about, with the newborns in particular, how the pressure on their head, and how that affects their spine and what have you, and how it can have other adverse effects, let's say, right, on the baby. How often would you recommend that a newborn come in to see you? And we're assuming that this is a healthy child, right?
Well, I recommend just one checkup.
Okay.
Let the doctor see if anything's going on. I mean, if there's nothing, you just want to go for prevention or
Hmm.
wellness. I'd say as that newborn starts to sit up and crawl or pull up and constantly fall on their bottom, that's an area where we would need
Okay.
checked. Falls, accidents, injuries, they happen, you know. And then, as they get older, they're in sports, they're in dance. Some children will tell you, my back hurts. Like I have 3-year-olds, my back hurts. They'll tell you. So, and if you see them, here we go. On my computer.
But
I tell my
yeah,
children, I have them pile up pillows and then they put their iPad here so they're looking straight. You should always look straight. You should never, always straight ahead. Better for your neck, better for your spine. So for good
great
spine,
point.
it's good to get at least, a couple checkups a year. But depending on what's going on with the body, you may need to check up every month. So everybody's body's different.
What's your thoughts on, so when you were talking about the pillows and looking straight, my first thought that I'm thinking is, what are your thoughts about like pillows in general, like sleeping on pillows, and mattresses as well, like firmness, if you have any advice or thoughts on those two things in particular?
Yeah, good question. So our spine has what's like an S curve. The neck kind of curves back like this. The mid back goes the other way and low back like that. We call it a lordotic in the neck and low back, or kyphotic curve in the mid back. We call that the thoracic spine, excuse me. So your cervical spine, your neck should have a curve in it. If I look this way, right, it should go like this, right? So there should be a pillow shaped that way to protect and support the lordosis, or the curvature in the spine. It's important to have a pillow. No pillow is not good. And a pillow that's like props your head up like this is not good either. Most chiropractors can tell you what pillow is best for you, but it's good to have a support in your neck. And please don't sleep on your stomach. Oh, my stomach sleeps first. I'm so sorry. You probably know. It's really not good. Yeah, don't sleep on your stomach. It's not good for your neck or your back. And then just you asked about pillow. Oh, mattress.
The mattress.
I tell everyone it's good to have something that's firm enough that it supports your back, but it's soft enough that you can sleep on it. So all those expensive pillow tops with fluffy, all this, but you lay on it, your spine does that, are not good. So if you want to go to the store, try them. And I'm gonna tell you something. I learned every store has different beds named something different. There's not one that's like, oh, they may name them different on purpose. So I'd say go sleep on your side. I mean, not sleep, is lie on your side, lie on your back. See what's comfortable to you. Like I say, something that's firm enough so if this is your back, it doesn't go like sink in like a hole, right? It's firm enough to support your back so your spine is straight. And, it's soft enough that you're like, nah, this is not a hard floor I'm sleeping on, if that makes sense.
Okay. So you mentioned about not sleeping on your stomach. And I'm asking because
if you say I'm lying on my stomach, that means I have to turn my head, right? So you turn your head to one side, feel the muscles on the side that you're turning towards. How do they feel? Really tight.
It feels
right?
tight.
Yeah. So your muscles are going to tense up on this side, and it's really going to cause problems for your neck and your spine. So same thing on this side, unless you can, sleep on your stomach with a hole in the middle, which is like a massage table or chiropractic table. That's what these tables are if you lie on your stomach. But other than that, you definitely want to be on your side with a pillow. So say if your bed is over here, your pillow, if it's too flat, you're not going to go like this. If it's too big, you go like that. You want your neck in the center. So we call them cervical pillows with a little dip. Will make up for that difference between your neck and your shoulder. So you can lie on your side or lie on your back with the proper C curve. But like I said, chiropractor can help you to figure out what's best because everybody's neck is different.
It's different. Yeah. Understood. I want to ask this question for the pregnant mamas now. What are some of your recommendations for our pregnant moms or soon to be pregnant mamas that they should take into consideration when it comes to visiting a chiropractor?
Good question. I'd say, when should they go? I'd say as early as possible, preconception, because the chiropractor is just going to make sure your body is functioning best. Think about pregnancy is a time people that you want to eat, where you want to exercise, make sure your body's functioning, but properly at its best, optimally, because you're going to be making a whole human, right? So it's the time to make sure your spine is in alignment. Just like if you were to take your car to the mechanic, change your oil, rotate your tires, do all these things so you can drive on that long trip. Same thing with our body. So that's what chiropractic care will do. So I find that my patients do best in labor when they have care. The sooner, the better. This will ensure that your baby gets in a good position, head down position. I have women that come to me because babies are breech, head up or head to the side, and having a C-section because you have to deliver a baby for the most part, head down. We do something called the Western technique. That's very gentle and easy. And it's hope. I've had a woman 38 and a half weeks come to me and I adjust them and their baby go head down. Whew, it works,
Wow.
right? But it's better to come earlier. And like I say, if you become preconception and have your spine worked on while you're pregnant, it's going to be so much easier. And then when it's time for the baby to come, the contractions, the brain will say, it'll release hormones, contract, relax, things will be in sync. Your body will open up. Matter of fact, the midwives, actually a couple of OBs said, Dr. Cohen's baby's getting the best position for birth. That's what we want. So my job is to line the bodies up so the baby's getting the best position. They're so smart. They just need to have the right space, because sometimes when we sit or carry our toddler on our hip or wear heels or, just life.
Right.
It causes our spine to misalign, especially in the back, this little tailbone area. We call that a sacrum little triangle bone. If that moves out of alignment, the baby doesn't have the best space to get into the best position. So that's what my job is to do, is to line the body up as soon as possible. The earlier, better. When you find out you're pregnant, that's fine. Just come to the chiropractor. 10 weeks, 20 weeks, 30 weeks, 40 weeks. That's at the end, but some things better than that. But the more you have, like I said, I've been doing this 23 years. My experience shows that when your body is lined up throughout your pregnancy, you have a smooth, I can tell when a woman's going to have a smooth birth. It's so good. It makes me happy.
Right. That's awesome. And I could tell that you're passionate about your work. And I think that speaks volume. I really, really do. So I have another question. How can mamas find you?
Good question. So my website is Caring Chiropractor, chiropractor.com. I am at 641 Pennsylvania Avenue Southeast, Washington, D.C., really close to Eastern Market Metro. We're steps away from. You can also go to Instagram. We are The Caring Chiropractors with the S. You can find us there. Those two places. And like I said, I've been in DC for 23 years. Love it. Happy. It's fun. I have a lot of students that I mentor. When they shout at me, I say, you don't want to do anything because of money, right? You want to do something free that you can get paid for. And that's what I feel about chiropractic. Like when I went to the office, it's fun. I enjoy, talking to the children, just walking around and using my hands. So we help people without the use of drugs or surgery. And I'm not saying that drugs or surgery are not necessary, because sometimes they are. But I believe that if you can help the body to be in the proper alignment, eat right, exercise, drugs and surgery should be last on the list. The body lines up properly in your body, you're healthy.
Amen. That's all I got to say to that. Amen. So as we close, I always ask this question. What do you think is something that mamas should know?
And so that's a great question. I want you to know that you need to take care of yourself first. You first. People say, in your airplane and oxygen masks come out, they say put it on you before you put it on the children. So I didn't tell Jess this, but I'm actually on vacation right now. Okay. I'm away, and it's a week where my children have finals, where my son I know needed help in math. And we literally been doing math every day for 15 days. I had a Zoom with the tutor past 2 nights. And guess what, y'all? He called me. He got an A on his
Yay!
And I kind of fantastic. Yeah, this was like a last minute trip, really. And I was like, we can go to my husband. He's a serial entrepreneur. We actually also have an IV hydration therapy business across the street. dc-drip.com. Y'all want to get the drip? Your hydration. Stretching. We do a whole wellness thing, like literally that we've been, running as husband, wife, parents, entrepreneurs, just busy. We need a break. So I say, take care of me. So literally last minute, lined up childcare. I brought this because I was like, I'm going to do this interview, jet it out. And we have literally been resting at the beach, sleeping, eating, resting, a little bit of exercise, but just really the mind is, clear, just really so we can go back and just get back into it. Just feeling more refreshed. So I'm going to say,
listen, I'm already envious. I'm listening to this sleep and this rest and this mind relaxation. And I'm just like, where are they selling this? Because I need it. I need it. And I'm sure others can relate. I'm sure they can relate. That's phenomenal. That is phenomenal. And again, thank you for your time. Thank you for taking this during your vacation.
It's my pleasure. I'm going to give you guys. Okay.
Go ahead.
I'll give you my phone number too. So those of you who are not on the internet and all that, just give us a call at 202-544-4478. That's 544-4478. Give us a call. We'll be happy to help. I'm sorry. What were you saying, Jess?
And we'll be sure to add all of that in the description, all your
Okay.
contact information as well. But I was just going to say, I think that is a testament to how passionate you are about what you do. She's on vacation. Hello. Like, I say less. I got nothing else to say about that.
You know, when you're home, like the schedule is tight. I knew I would have more time, and I put it in my little things to pack. Uniform, because I mean, I knew it would be better for me to, it's kind of hard today. I was like, oh, which time works best? Because I don't want to, just kind of keep it easy breezy, but it was fine. It worked out. This is my passion. I love it. I can talk about chiropractic, as you can see, all day, but yeah, it works. It's better. So, we get back, it's like, ooh, what do we have? So I'm honored. Yeah. Thank you for helping mamas, because mamas matter, Jess. Thank you for doing this for all of us, because
this is facts.
For giving us.
This is facts. So mamas, thank you so much. Dr. Rashida Cohen, thank you so much. Again, we appreciate your time and your hello, the gems. I hope you caught the gems that she was dropping and the jewels. Thank you. And until next time, guys, we will see you soon. Bye.
My pleasure. Bye.
Wasn't that dope? Thank you so much for joining us today on Conversations with Jess. We'll see you in the next one. Bye.